Hi guys, my name is Marissa Rivera and today we're going to be talking about congenital heart defects. Before I go more into the different pathologies, I think it's important that you understand a little bit more about the way the blood is supposed to be flowing through the heart. So let's just take a look at the diagram and I'll show you exactly what I'm talking about. Alright, so this is the diagram of the heart. The deoxygenated blood comes into the heart from the superior vena cava, where it goes into the right atrium. Then it passes through the tricuspid valve and then goes into the right ventricle, going out of the pulmonary semilunar valve into the pulmonary arteries. This is where the blood exits the heart and goes into the lungs, where it becomes oxygenated blood. Once the blood becomes oxygenated, it comes back into the heart from the pulmonary veins and into the left atrium. It passes through the mitral valve, also known as the bicuspid valve, and into the left ventricle. From the left ventricle, it passes the aortic semilunar valve and into the aorta, where the blood goes into the rest of the body. So now that we know how the blood is supposed to flow through the heart, we're going to talk more about the congenital heart diseases that affect this blood flow. Um, There are two different types of congenital heart diseases. There's cyanotic, which is a blue colored skin caused by lack of oxygen, and non-cyanotic. The different defects that we're going to be talking about today are the atrial septal defect, ventricular septal defect, the patent ductus arteriosus, aortic coarctation, and the tetralogy of Fallot. Okay, so this is a diagram of an atrial septal defect. As you can see, the picture on the left is of a normal heart, and the picture on the right is a heart with atrial septal defect. What it is a hole that allows oxygen-rich blood from the left atrium to flow into the right atrium instead of continuing its normal path to the left ventricle. Over time, this causes medical problems and sometimes arrhythmias, which is an irregular heartbeat. Most of the time, more than half of the time, the atrial septal defects close on their own, while some others have to be repaired with a transcatheter procedure or open heart surgery. With the transcatheter procedure, a clam-shaped device is placed on both sides of the septum, and then they're attached to each other under guidance of floral. So that's where we come in to close the hole in the heart. All right, so here's a diagram of a ventricular septal defect. Um, it's a non-cyanotic congenital heart defect that is a hole in the ventricular septum that allows oxygenated blood to mix with used deoxygenated blood returning to the lungs. On the left, you see the atrial septal defect, which is a hole in the septum between the two atriums, compared to the ventricular septal defect, which is a hole in the septum between the two ventricles. Although most VSDs close on their own, larger ones that stay open can cause arrhythmias, endocarditis, or heart failure and require repair. Um, some of them can require open heart surgeries, while others can be repaired under floral or transcatheter procedures by placing a patch over the defect. Okay, so this is patent ductus arteriosus, which is a non-cyanotic congenital heart defect. Before birth, when the baby's still in the womb, the baby has a blood vessel that goes between the aorta and the pulmonary artery that should close shortly after birth, called the ductus arteriosus. If this doesn't close, PDA results in oxygen-rich blood from the aorta mixing with oxygen-poor blood in the pulmonary artery. It can be closed off through cardiac catheterizations. With the aid of floral, a small cut is made in the groin and a catheter is passed to the heart through an artery. Small metal coil is then passed through the catheter, and it's passed into the infant's ductus arteriosus artery, and the blood flow is blocked, correcting the problem. Another pathology that we're going to talk about is called aortic coarctation. This is when a part of the aorta has a stricture or a very narrow section. It makes it difficult for blood to get um, to the lower extremities. There's usually high blood pressure before point of coarctation and low blood pressure beyond the point of coarctation. Over time, this can lead to extremely high blood pressure or endocarditis. In order to fix this, what they do is something called angioplasty. It's where a small balloon is inserted inside of the aorta using fluoral, and it's inserted with a small wire through an artery in the groin and up into the aorta, and that's where the balloon is then opened up in the narrow area. Then a stent is usually left there to help keep the artery open. The tetralogy of Fallot is a cyanotic congenital heart defect. It causes a bluish tint in the skin due to lack of oxygen. What it is a combination of pulmonary valve stenosis, a large ventricular septal defect, an overriding aorta, and right ventricular hypertrophy. An overriding aorta is when the aorta is located between the left and the right ventricles, right over the ventricle septal defect. This results in oxygen poor blood um, from the right ventricle to flow directly into the aorta instead of the pulmonary artery. A right ventricular hypertrophy is when the muscle of the right ventricular is thicker than usual because it has to work harder. Um, Tetralogy of Fallot can only be repaired through open heart surgery. This also requires the patient to continue receiving medical care from a specialist after surgery to remain as healthy as possible. Okay, so we just went over a few congenital heart defects. Remember that congenital heart defects is a term that's used to describe when some part of the heart does not form properly during development of the fetus, causing a change in the normal flow of blood to the heart. The simple heart defects such as the atrial septal defect, the ventricular septal defect, patent ductus arteriosus, and aorta coarctation can usually be resolved without having to perform open heart surgery. More complex defects, such as the tetralogy of Fallot, actually require open heart surgery. With the help of fluoroscopy and advanced surgical procedures, a child can lead a healthy, normal life. Thank you for watching my video, and I hope you guys learned something about congenital heart defects.